Thank you very much for joining us.
Thanks for having me.
It's been a long time with this pandemic and your time in Canada. Now it's about to come to an end. How are you feeling?
Well, emotional actually. It will be bittersweet to leave. We feel a bit uprooted right now. Everything's packed. For me, probably the most important thing is just to make sure that our kids will have soon a home again. But we will miss you people.
A lot of people here will miss you as well. You've always been very candid in all the media interviews you've done, but you've also been cautious, and that makes sense as well. Maybe you can be a bit freer with these two questions. I want to ask you, first of all, as you look back at the response to the pandemic, and your focus obviously was Ontario, but what do you think we got right?
Oh, we did an absolutely outstanding job with vaccination. We just went for first doses first. Other places didn't do that and had much more of a challenge. We had a really, really high coverage, meaning people embraced the science. And we then went for our second doses when it was needed, when the Delta wave actually just kicked in. And in quite some places, we were also able, to deal with inequities much better. We made sure that we actually were able to bring vaccines to those people first who needed it most.
It feels to me like right now we're at a time of second guessing, that there are critics of how the pandemic was dealt with who are saying, we shut down more things than we should have. We had too many restrictions. Vaccine mandates were wrong. As you look back now, is there anything you would say that we did that was wrong, that we got wrong?
I think we didn't immediately embrace masking, and many places in the world got that actually wrong. If anything, it was that we weren't restrictive enough if it comes to masks, and we just need to be aware of. We did a lot of things really well. When I look here, in Ontario, we hardly had a Delta wave. Why? We kept masking and we really had this successful vaccine rollout. That made a difference. We had full liberties, actually, and nearly no Delta wave. Compare that with what happened in the US.
Now, some people watching are going to say, look, Dr. Juni and Ian are not wearing masks right now. Are we being prudent and safe right now?
I think it's a really well-ventilated space here. We're 2 meters apart. The CO2 levels in this room would actually be really low. I'm fine with it, and we just need to be aware of that. Luckily, now we're just having a lot less infections than only about 3 to 4 weeks ago.
Yeah, and we don't have symptoms, and we're fully vaccinated, so hopefully this is a prudent thing to do. Feels prudent to me. I think it's easy also to forget how grueling the pandemic was, especially for doctors and scientists. And as you think back to September of 2020, Christmas of 2020, pick whatever milestone you want. As you look back, what was that like?
Well, look, at the beginning, we were all overwhelmed now. Just thinking about the experience in northern Italy, for example, and the virus at that time, with retrospect, was actually very timid and nearly lame. And still we struggled that much. So we learned a lot, and the longer this went, the more we learned about how specific we needed to be with our measures, which measures worked, which didn't. And I would hope, that we also have learned a lot about, the future, the next pandemic coming.
So the science table, not it's maybe unique in Canada, or at least certainly not every province has something similar to that. But you had a really important role in terms of looking at studies and coming up with policy suggestions. Were you ever in any way influenced by government officials?
Never, ever.
Not even subtly,
Nothing.
No.
Look, I can't tell, how much of that was also the protective effect of Steiny Brown. Steiny is amazing, he is the Dean of the Dalai Lama School of Public Health here in Toronto, and he always took academic liberties very, very seriously. So I never had any exposition that was, indicating interference. You took 1 day off during the first, 18 months of the pandemic, which doesn't seem healthy to me, but anyway, you're the doctor. And that first day off was Valentine's Day of 2021. Tell me about your experience then. Yeah, it was amazing. We went to Scarborough Bluffs, And you know what got to me was basically just to experience the people out there. You know, just walking around in Scarborough Bluffs, beautiful. Everybody adhering to the public health interventions. All the diversity, people from all the backgrounds, and we just were in it together. And it's just what I needed there. You know, I just went back and just felt like, okay, let's go again. And it was just right that I had worked my ass off.
So that's the beauty of people who are all in this together. Let me talk about one of the ugly points. And this is true of a lot of people. A lot of people had versions of this experience. Ugly criticism, but even death threats. And so what was it like for you to endure that?
Yeah, it only happened once, actually. This was when Omicron hit. And also, you know, to be fair, I made a mistake. I gave some material to the tabloid press that allowed them to weaponize a statement I made when I said, we need to stop moaning, when I just should have said, we need to change our attitude. We need to stop moaning, face the reality and do the right thing. It's as simple as that. And that's when we really got death threats. And what got to me there was, of course, you know, those threats against my family and, you know, emails saying, we know where you live and we will come after you and your family. That got to me for a moment there. You know, I was already exhausted. But, you know, this was just a few days. A friend offered their cottage. We disappeared. We were very lucky again. Nothing happened. Nearly everything else, or actually everything else, was always positive. All the interactions with the public outside, you know, in the streets of Toronto, it was always positive. Yeah,
and when I interviewed you on Cross Country Checkup on CBC Radio, I hope you remember, there were people who called in specifically to say thank you to you. So yeah, there was certainly a lot of positive reaction. And
you know, people need to be aware of that. I got these emails. I don't know whether you will ever read this email. I read every single one of them, and it really kept me going personally. There was so much gratitude out there, the feedback, it kept me going.
You're going to Oxford, but the pandemic continues. And so for the other scientists and doctors who will be leading us through whatever comes next, like we don't know what the fall is going to bring, what advice do you have for them?
I think if we keep being honest with the public and if we keep being independent and therefore deserve the trust of the public, this will go a long way, you know. It really probably made a difference also, you know, compared to places like the UK, where people never quite knew how much of the information that the government got, they got. And that was certainly a difference here in Ontario. People hopefully understood what the government heard, they heard too.
6.5 years, did you say you were in Canada?
Yeah.
What are you going to miss about this country?
The people, the society. This was our home because it was a home for everybody. You know, somebody said that to me relatively early on. They said, I look at Ontario as, you know, the world's lifeboat. That's how I look at it too. And I think this holds for a lot of Canada, actually. And it's just a society that works, that isn't that polarized, and people haven't forgotten how lucky they are, perhaps because many people came here from places that were less lucky. And this is amazing, and I'm not aware of any place in the world where this works that well.
I know you'll miss Canada, and I know a lot of people here will miss you. Thank you for speaking with us.
Thanks a lot.